Britain becomes the first country in the world to use the Pfizer-BioNTech vaccine. So the first person to get it in Britain and therefore post-trials in the world was 90-year-old Margaret Keenan, who was given her dose of the vaccine at University Hospital in Coventry at 6:31 this morning.
It was fine. I wasn't nervous at all. It was really good. Go for it because it's free and it's the best thing that's ever happened at the moment. So please go for it. If I can do it, well, so can you.
There we are. And actually, the second person to get the jab, I was just saying to Ken about half an hour ago, a guy called William Shakespeare from Warwickshire. In the coming weeks, millions more of us will follow. You do need 2 doses of the vaccine to be fully protected. So Margaret and William and anyone else who got the jab today will need to return in 3 weeks. Once they've had the second dose, within a few days, they are protected. And we've gone through a hell of a year, haven't we? So maybe we can finally say that light at the end of the tunnel is not an approaching train, thanks to the vaccine and others that we hope could be approved soon. But of course, the magnitude of what needs to be done now is enormous too. Never before have we had to immunise the entire population in such a short space of time with a brand new vaccine. It's a momentous day for the NHS. It's a very challenging one. This is the boss of NHS England, Sir Simon Stevens, speaking yesterday.
Tomorrow is the beginning of the biggest vaccination campaign in our history. Building on successes from previous campaigns against conditions, diseases like polio and meningitis and tuberculosis. So hospitals and then GPs and pharmacists, as more vaccine becomes available, are going to be vaccinating at least until next spring. So in the meantime, we're going to have to continue to be very careful. But if we do that, I think there's every chance that we will look back on tomorrow as marking a decisive turning point in the battle against coronavirus.
Tomorrow meaning today. And we now look at what happens now. What is it like to get the vaccine? How soon will we all get it? How on earth do you immunise a whole population? Maybe you're somebody in one of the categories, you've got your appointment booked, or you might have even had it already. 88291, email vine@bbc.co.uk. Somebody who's getting vaccinated this afternoon is Dr. Matt Morgan, intensive care consultant and author who works in Cardiff. And you're in the category of health worker, obviously, Matt.
Yeah, I am indeed. I'm currently sitting in my car outside a vaccination centre, tucked in a residential place in Cardiff, actually, and I'm due to have the vaccine in about an hour's time.
And you booked your appointment last week, I gather, did you?
Yeah, so when this roller was announced, the place where I work, the trust, decided on the groups who should get the vaccine this week, and intensive care being in one of those frontline groups of one of those. And so it was done fairly simply with a phone call, both appointments booked in, actually, the initial one and the one 21 days later.
I'm assuming that health workers, by and large, will all say, yes, please, and I'll have it. And then somebody actually said to me the other day, actually, the level of anti-vaccine skepticism among health workers is higher than you might imagine.
Well, I can only speak for myself, and talking about safety is important, of course. But for me, the most dangerous bit of this vaccine I've already done, and that's the car journey here. Everything in life has risks, and yet we have to balance the benefits with the risks. And this Christmas, of course, many people throughout Britain will be taking one of the most dangerous drugs in the world, which is alcohol. We do that despite the risks because of the benefits it brings. And for me, this vaccine comes with huge benefits and tiny risks.
Yeah, my question was really about whether there is any anti-vaccine sentiment among health workers that you've noticed.
Yeah, no, certainly none that I've heard of. We do discuss things like safety and science and data, as we should, and that should absolutely be done. But those who have been at the front line, seen patients and families, and the complexity of COVID in the health system, I'm sure will certainly not want to be there themselves.
We've come on an amazing journey. I mentioned that the first time I mentioned corona on this program was January the 22nd. So within a year, we've started to turn on the virus and take the battle to it. That's incredible, isn't it?
It's incredible. And in fact, it's 38 weeks to the day that the first intensive care patient with COVID was admitted in the hospital where I work, and we helped to care for them. And so it's remarkable, in less than the term of a full pregnancy, we now have a vaccine. Saying that, we cannot be complacent. And the biggest danger of this vaccine is probably complacency, actually. We have to keep doing all of those things that we know are simple and are boring and hard to do, like social distancing, because this isn't going to turn COVID for weeks or months. And we have to keep on doing those other things.
And just to be clear, finally, Matt, on the timetable for you. So you get it this afternoon, very soon. And that's dose number 1. Dose number 2 comes when?
Yeah, that's very soon. Days later. I'm having the Pfizer vaccine, which is one of the mRNA vaccines, and it's a 21-day.
Hello, Doctor. With you very soon.
Thank you. Are you protected immediately you've had dose 2, or do you have another little window after that?
No, in a way, this changes everything, but it changes nothing. It will change nothing but the equipment we have to wear in work, the PPE. You still have to go through all of those precautions as if you weren't protected to start with. And of course, even after the second dose, nothing in life is 100%. So being cautious is always important, but you can be with the psychological benefit that the protection is there to some extent.
So if we take the 95% figure for where we think it works, how long after the second dose are you theoretically protected?
Well, it's not an all or nothing. Everything is gradated, and every day after this first dose today, I'll be slightly more protected, and again after the second one. But in general, it's around a week or so after that protection it was marked as 95%. But, we don't know how long that immunity lasts. That's one key question. And there's also some questions around the transmissibility of it.
Thank you very much, and good luck today. Thanks so much for coming on. Dr. Matt Morgan, intensive care consultant, one of the first to be vaccinated in the country. Dr. Bharat Pankhania is, no, I'm going to go Pankhania. I'm so sorry. Senior clinical lecturer at Exeter College of Medicine. Good afternoon.
Good afternoon.
I was right to go Pankhania, wasn't I?
You were absolutely right.
I'm so sorry. Not at all. Now, let's just talk about the scale of the task if we can, because it's one thing to get the first day done and Margaret and William Shakespeare and so on, but we're talking millions here.
Yes. And I, in my moment of spare time over the weekend, was doing some quick sums. And I was trying to work out how many minutes each vaccine takes and how many people we've got to immunize and how many people would we need to do the immunizing. And having done those quick sums, I felt very good, because I then felt, yes, I have done the homework and I can see that within 3 to 6 months, we can immunize the majority of the UK population. So now that I've done the sums, I think, yes, it's possible. Yes, we can do it. And what we would need is many people who are doing the immunizing. I did a sum of an experiment of what would it look like with 5,000 or 10,000 immunizers, and that's easy. And similarly, when general practices and other places start offering the vaccine, we will pick up momentum.
Okay, so you don't see this as being an impossible challenge?
No, not at all. The United Kingdom has got its primary care services in place, and we give our routine immunizations every day. And we're only going to boost up that arm of our immunizing service. And I expect that with boosting up of existing infrastructure, systems in place, we will be able to do it and do it efficiently. We have a very good immunization program in the world.
I suppose the annoyance is that we have to give everyone the vaccine twice. Because
yes,
if it was, is there not a way around that? Is there not a way of giving them a delayed dose or something?
You ask a very good question. So I would answer as follows. Whilst it says that the second dose should be separated by 21 days, the strategy I would pick as a public health doctor would be immunize as many people as I can with the first dose. The second dose can be given after 21 days. It doesn't have to be spot on the 21st day. That way, I maximize the number of people with the first dose. And then when the vaccines become more available, I do the catch up and give them the second dose as well. And then after the second dose, 7 days, and you reach your maximum protection levels.
I know, Dr. Pankhania, you've worked with communicable diseases such as Ebola and SARS and influenza and so on. So let me just ask you this about herd immunity. With the MMR jab, we're told that if herd immunity sinks below a certain level, then it becomes really quite dangerous for those people who can't have the jab. Is the same true with this, or do we just say, no, everyone can get vaccinated, so that if you don't want a vaccine, that's fine. You're only going to hurt yourself?
In a way, what you said is right. So in the middle of a pandemic, what would I be doing? I'd be using my path of least resistance. In other words, immunize as many people as I can, including the vulnerable groups. And thereafter, once we've achieved 60-70% coverage, you will find that the level of circulating virus in the community starts to drop. And therefore, the catch-up program of persuading other people if they will take the vaccine comes into play. But in the first instance, you do what you can do much easily. And of course, people have a free choice, and that's fine. But what we have to do is allow experts. And I remember talking to lots and lots of parents about the MMR, and I took them with me. I never forced them. I showed them the evidence. I showed them what a disease looks like. I showed them the side effects, if any, which is just localized and some little temperature, that sort of thing, compared to the benefits. And I managed to persuade most of my patients. That's the strategy I would take with people who are concerned, but I would never force them.
Are we at a point there when, let's say, take an example of somebody who has the vaccine today and then their second jab is in 3 weeks, and then they're told a week later that's basically they're protected if their body works that way. Can they just then take their mask off and circulate as normal again?
No, and that's a really good, important question you ask for the benefit of our listeners. The shortest possible answer is no. So protection against SARS-CoV-2 is multi-layered. So the multi-layered is you wear your mask, you keep your social distancing, you avoid crowds, you avoid unventilated places, and the immunization is a good armament, a good extra layer of protection. Now then, once we've immunized many, many people and followed them up, we will have a pretty good idea about how many of those infection control measures we can slowly start to drop. But now is not the time to drop those infection control measures.
So it sounds to me like we're wearing masks for most of 2021.
Probably. And it may also be a cultural change whereby whenever anyone has a flu-like, cold-like illness, they wear a mask to protect them, protect other people, like they do in the Far East. And it is not a bad thing to not spread your infections if you are infected with anything.
Thank you so much. What a lot of wisdom there. Really helped us. Thank you, Dr. Bharat Pankhania, who's a senior clinical lecturer at Exeter College of Medicine and knows a lot about communicable diseases and pandemics, has worked on Ebola and SARS. What a fascinating gentleman. Thank you.
Thank you.
BBC Radio 2.